now is Dr. Rob Davidson. He's an emergency room physician in West Michigan. He is also, by the way, the executive director of the Committee to Protect Medicare. Doctor, I'm curious about that. You had Jay Gray right there in Dallas. You had another reporter previously, Sam Brock, in Miami, Florida. Temperatures are in the 90s in both locations today. Whatever happened to that whole concept that once the summer gets here, it'll just burn away?
Yeah, I don't think anyone ever thought that was absolutely serious. The president certainly touted that and was hoping for that. But as we see, as people want to get out, want to get together, as people are heading back into churches, back into bars and restaurants, this thing is completely out of control. And the White House apparently recognizes this. They're telling us we're just going to have to live with it. I just wish that part of living with it in their minds was mandating wearing masks nationwide and the president wearing a mask so he could model that behavior.
Speaking of, Doctor, we have talked about for so long now, it feels like, the importance of wearing masks. So what exactly is that crucial tipping point? How crucial would that have been if the president had mandated that for his most recent celebrations on July 4th?
Yeah, there's no way to know for sure, but we have studies out of China now showing households where nobody had the virus. When they wore masks and then somebody turned up positive, there was a 79% decrease in the transmission just within a household. So imagine if we have thousands of people gathered together. We don't know the numbers. We know it's much greater than zero, and we know that everything we can do in something as simple as wearing a mask, we have to be doing.
President Trump's events on Friday and Saturday, of course, drew those huge crowds. Have we talked at all about the timing it might take? Because previously it was 2 weeks. It's now looking like what we're seeing from some of these so-called super spreader events could be closer to a month when we see these results.
Yeah, I mean, I think within 2 to 3 weeks, we may be seeing cases rise. But as we're seeing in Florida and Texas, they're younger people initially. We probably had younger people in New York running around with the virus before we saw hospitals get full. We just didn't have testing to know that they were out there. So, yeah, I mean, 4 weeks, 6 weeks, somewhere down the line, we are going to see the absolute abysmal effects of these events that the president is hosting.
So the administration's new policy is apparently to just kind of live with it, to go about our lives and live with it. We're looking at live pictures there at Myrtle Beach. How, as a physician who's there on the front lines, how should we live with this virus? Should we go out in public and be at the beach today, or stay indoors and try to do our own stay-at-home policy? What should we do? Because it's still out there.
It is out there, and I think people should absolutely be going outside, and they should be enjoying their families in very close units. But if you are going to be anywhere in proximity of other people, you should have a mask with you, and if you're going to be within 6 feet, you should put on that mask. I go running every other day, and I bring a mask with me because I live in a fairly rural area. But if I come across a situation where I can't be at least 6 feet away from other people, I put on the mask, I get by it, I take it off, I sanitize my hands, and I move on. And I just wish that people would follow that advice. And knowing that this president has no intention of protecting the living, he's more worried about people who are represented in statues who are already dead. We just have to do everything we can as Americans to stop the spread.
And Doctor, real quick, I want to get your take on the new numbers reported by the World Health Organization, the massive uptick from global cases. Of course, the U.S., Brazil, and India being some of the biggest reporters. What is your reaction to that when you first saw those numbers? What was your first thought?
Yeah, it's crazy that over 200,000 people tested positive, but nearly half of those are from 2 countries, America and Brazil. And our 2 leaders, Bolsonaro and Trump, have very similar approaches to this virus. They don't wear masks. They call it a little flu. They tell us it's no big deal. Now Trump is saying 99% are absolutely harmless. And, you know, we see the effects of that. So I think we'll wait and see what the rest of the world decides to do as they see the cases start going up. I imagine we're going to see a much different response than we're going to be seeing from the White House this week.
Come September, the next holiday, Labor Day, are we in a better position than we are right now?
No, I think we'll be worse off in September because I think we'll be closer to the election. I think the rhetoric will be amped up. I think the desire to look past this or to, you know, continue to claim this is somebody else's fault will be there. And I fear we're going to be just either the same or doing significantly worse based on the events as we're seeing them unfold.
Dr. Rob Davidson in Michigan, where they're also seeing an uptick after working so hard to get their cases lower, too. Doctor, we appreciate you being on with us this morning. Thank you.
Dr. Davidson.